Specific health insurance advice, please call the health insurance store at 724-603-3403. The host or guest may not be able to mention specific health insurance companies. You cannot change, purchase, or bind any insurance policy over the radio.
This is the Health Insurance Store's Medicare A to Z on your local station, WMBS. Brought to you by the Health Insurance Store in Connellsville. Again, if you want to call them, 724-603-3403. And this afternoon, the first Monday in February. Hard to believe that February's already done.
It is. January's done. February
yeah,
just started.
February's already.
See, are you testing me already?
No. I'm testing myself and failing miserably.
All right, January's done. February's here. You're right.
You may notice that is Tony. Tony. I almost said Tony and
Tony and Dawn.
Yeah.
Tony Orlando and Dawn.
Yeah. No, Tony and who does the basketball with.
I thought you said. I'm thinking Tony Orlando.
DiRoma.
Yeah, Tony
DiRoma. The Health Insurance Store. And Aaron is away and enjoying himself, and so we'll enjoy Tony here. Again, if you want to go to the Health Insurance Store, they're at 121 Pittsburgh.
121 North Pittsburgh Street.
North Pittsburgh Street
yeah.
in Connellsville, or you can give them a call. And actually, we talk about the address and the phone number a lot.
That's right.
But the Health Insurance Store also has a very significant social media presence.
We do, yeah, and growing by leaps and bounds, really, especially in light of a couple of decisions that Aaron Zolbrod, who's the founder and the owner, and it's funny you say about him being gone. I think I talk to Aaron more when he's gone than when he's in town. I don't know what it is, but I get more calls and texts and emails from him, I think, when he's out of the area than when he's right down the hallway. So I'm not sure what happens there, but he has made some changes. The biggest one, and I know we touched on it because I think 2 weeks ago, Martin Luther King Jr. Was here, and I think it was just happening, or maybe just happened for the first time. Aaron, for many, many years, just like he's been coming on here and talking to you, Bill, and Brian, and I'm sure, I assume there were people before you and
there's
that he
been
talked
a whole,
to, but but he's been doing this show for years, and he's also I'll use the past tense, I guess is correct right now. He had been for many years writing articles weekly that would appear in the Pittsburgh Post-Gazette. But media is changing. I think radio is changing. There's a lot more podcasting going on. There's other platforms that people use to get their message out. And so I think 4 years ago when I started at the Health Insurance Store, I just realized it's today my anniversary. No, yesterday was. So 4 years I've made it.
You started on Groundhog's Day?
It was February. Well, actually, it was February. I'll have to look. February 1st, I guess it was. Yeah. February 1st of 2021. And I think probably even back then, Aaron had floated the idea or the concept of debating whether or not it still made sense to be writing these articles based on a number of reasons, business and just feedback and whatnot. These articles that he would put in the Post-Gazette, which I think I'm allowed to say, I'm pretty sure, yeah, I know it's been, he paid for them, right? So this wasn't, a lot of people have said, well, they should be paying you to post the content.
Not their business model.
Yeah. No. But in reality, it was a pretty big cost for us to be there, and that was fine. The one thing about Aaron is he has never, whether it's business, personal, philanthropically, doing things in the community. If Aaron's a believer in something, money doesn't deter him, Bill, from doing something, and you know that as well. So for many years, the money that he spent, in part, would have contributed to the growth of the Health Insurance Store. But things do change, and so got to the point where, and I'm pretty sure he negotiated and went back and forth more than once with the folks there, the fine folks. I have nothing wrong with the Post-Gazette. This isn't negative towards them. It's just a business decision. But he did stop a few weeks ago. His articles no longer appear in the print or in the, I guess, the electronic. They have a subscriber or electronic version, whatever that is.
Yeah.
And
you have to go through the gateway on that one.
Yeah, so I hate that when you're trying to read an article and you got to subscribe, but that's okay.
Yeah, you start into it, you got the first paragraph, you're into it, and then
get it.
If you want to read the rest of this article, fork up. Yeah.
Right on. Yeah. So, but again, things change. Things change drastically, and so that decision had been made, and so we use Facebook, which is not the only platform in the world, but we do a lot of Facebook posting. We have the health insurance store, which has its own page, and then the Ask the Medicare Specialist, which is, I believe, what we call this segment, right?
Right.
It is also what I think those articles were called, and is the name of the one of our Facebook pages, Ask the Medicare Specialist. So, so articles are still being written. They're just not available through the e-version or the written published Sunday version of the Post-Gazette. So that decision was made. That ship has sailed. However, we want to make sure people realize you can get, and I think WMBS, I'm pretty sure I saw, you guys are going to have the ability to share those articles on your page, your Facebook page. We know for sure that they're going to appear in the Ask the Medicare Specialist page on Facebook. But I guess what had happened is the day that Aaron wrote his last article, and he said, basically, this is my last article, he had quite a few people reach out to him, and they said, well, but we don't do Facebook, or we don't have, it's not something we do, or we're interested in whatever. So the other thing, and I know I checked, I brought two of the most recent articles with me to potentially read through later and talk about them as time allows later today. But the last two Sundays, those articles that were written are available not only on the Ask the Medicare Specialist page when the day comes, but they are also posted on our website, right? So our URL is getyourbestplan.com. And so that change has been made as well.
And you also post the archived
Yeah.
Articles as well.
Yeah, no, I don't know. When I checked it today, we had a lady that had posted one of our pages. So I guess I can do administrative whatever. I can respond as not as Tony, but as the health insurance store. And so I try to help monitor that page. And I had seen a lady that had written in recently, and since we made the change, and she said she was having a tough time finding the article the first week. And the truth is, when I checked, I'm like, you got to scroll down, give it a lower. So we have had that change made. So when I look today, not only I think was there a tab, but they also were at the very top of the page.
Right.
So
if you want to see the most recent article, it's right there.
And you don't have to have a Facebook if you don't have it. If you're not a Facebook person, and you at least have the internet. Now, if you don't have the Facebook and the internet, I don't know what's next. We're open to suggestions, I guess, right there.
Get somebody that you know who has.
There you go.
Who has online, or you can go to. There are libraries and things. There are resources for going online. So there is always that. But getyourbestplan.com.
That's correct.
And you can also see pictures of the staff. Of course, you can also see a picture of Tony right now. We are live streaming this on our Facebook page.
Tony just wiped his nose on Revive Radio, so that's probably not professional. But
well, then again, it's better than not wiping.
That's true. That is true.
Or if you want to call us on the air, if you have a question for Tony regarding health insurance, whether it's for your personal use or say you have a business and you are thinking about either changing your health insurance plans or adding one, again, One of the things Aaron keeps stressing is that one of the ways to hang on to good employees is to have good medical benefits.
Good medical benefits. As an employer, are a tremendous selling point, right? I mean, we have a Jennifer Shaney, who is she is, Aaron wants to give titles, and I'm the life insurance specialist or the drug giving me titles that don't appear anywhere in print, except for I appreciate
maybe
the
on
nod.
your business card,
Right.
yeah.
But I will tell you that at the health insurance store, there are certain titles that certain people hold. Jennifer is the gal there that does our group health insurance plans. So whether you have a small group or a large group, that's her niche. That's one of the things and areas that she specializes. We don't all do it, just like we don't all do life insurance, but I do. And so, yeah, that's definitely one of Jennifer's areas. I pick her brain once in a while, but it's not my lane. I mean, I stay in my lane as best as I can. So,
But if you call the health insurance store, they will listen to your question and then they will hook you up
Yep.
with the correct person. And we also don't touch on the life insurance aspect as much either.
Yep. I always come prepared to do that. I guess since we're called the health insurance store, we talk a lot more about health insurance. I always, and maybe today will be the day, Bill, that I'm always prepared to, and I've had guests on with me. I think just like for years, Aaron has been on here talking about Medicare.
Right.
There are some basic principles of life insurance that I think are more than fair and logical to talk about, if time allows at some point today, for sure. But yeah, just it's an interesting time for us because this isn't our busiest time of year, I guess. Several of the enrollment periods that were considered open enrollments have come and gone, and it's actually, honestly, it's a little refreshing because you get to take a breath and get caught up on some
recharge
things.
a little.
Yeah, like I spend a lot of time this time of year doing, and I'm in good shape, but we talk about what we have to do as agents. We have certifications, we have trainings, we have continuing ed requirements. It's an industry that changes and the rules change, and I spend a lot of time. Honestly, I listen to podcasts. I have Facebook groups that I'm a part of, all Medicare or health insurance related, different forums, chats, and I guess, when it's what you do for a living, and it's what you talk about all day long, you just have to do everything you can do. And I'm dedicated to just don't always have the answers, but trying to anticipate the question before it even happens. But I do like also the experience that we have. As I just said, I just hit my 4-year anniversary. I certainly have not encountered, nor will I probably ever encounter, every possible question or scenario, right? I talk all the time about how many times the presentations and the information that we give is repetitive in nature, but you're giving it to somebody for the first time. Well, we hear things all the time, potentially, that we've never heard before, or certainly don't hear often, right? And so we have people like Bonnie and Alicia, and now they have a gal named Chelsea. All three of those ladies down in the Forest Hills office. Tons of experience. Artrell's one of my coworkers in Connellsville. He and I had spent some time in Forest Hills. We would each take a day and go down to Forest Hills before they hired Chelsea, because they had an empty desk and they would get busy, and it was good for Artrell and I to, kind of sharpen our swords, and different clientele, different scenarios you might run into in a Pittsburgh-based business versus Fayette County, Connellsville, Uniontown area. And so I got to know Bonnie and Alicia there, and they're unbelievable. they're fountains of information, very willing to share. Both have a ton of experience. So I learned a lot being down there. And now they have Chelsea down there she's in a she may not realize this, but she's in a fantastic position to be her age, to be in this industry and to be able to learn from those other two gals is going to be a real blessing for her. For me, like I said, 4 years into this, I still probably at least once or twice a day will go down the hall looking for Jennifer, looking for Sadie, looking for Lonnie, just picking their what would it be, picking their brains? I don't know, what's the term there?
Yeah.
Help me out. Do you know what I mean, though? It's just I heard something, I read something, I just had a call. Have you had this before, or did you know this? Just sharing information, because so many changes and so much to keep up on.
And I'm sure they come in and ask you questions. So it's a lot of shared information.
I think probably because I do take this very, very seriously, and I think they all would probably at least think that I do try to keep on top of things as much as anybody. So that if there is something new, that there's a pretty good chance that I've heard about it or whatever. So I'm getting my spot, And then, you know what? It's not even. So we have the agents, right? There's, like I said, in Connellsville, there's Aaron and myself. Yeah, we get to come on the radio and talk. I sent an email this morning, Bill.
Yes.
And I said, I am going to do the radio show today. Does anybody else want to come with me? Does anyone want to call on? Does anyone want to, promote themselves or the business or anything? And, crickets. I get crickets. Now, Bonnie said Bonnie was otherwise. But the one thing Bonnie said is, and this will come through because I'm going to read one of her Feel Good Friday stories. She back to social media. She wrote a post a couple of weeks ago in our Feel Good Friday segment, which is one of the regulars that we do. And she wrote one and she submitted it, and we kind of edit, people pass things around. You want to clean them up or make sure they're grammar, you can make a spelling mistake, whatever. So I was helping edit and look at that one for her. And I emailed her. I said, that's my favorite one I've ever read. And I want to read it later because it exemplifies everything that goes into what we do at the health insurance store. And then you even have the administrative people. I mean, it takes, what do we have, 15,000 or something clients? It's a lot of people. And I mean, that's a very well-oiled machine over there. We have systems in place. We have people like Deb and Denise and a gal we hired, Casey, who helps. They do scheduling. They do, confirmations. Those women, I'll tell you what, they know a lot too. Now they have to draw a line sometimes, Bill, because they're not licensed agents. So they'll get to the point where there's certain things that maybe we should be officially telling them. But you hang around with people long enough and you just pick up things, right?
You absorb things.
Yeah. So even the people in the administrative roles, even though they're not agents, they're very knowledgeable, and they can, and we want them to honestly be able to answer certain types of questions, right? If someone calls in with a question, every single call doesn't necessarily need to be routed to an agent, right? If you came in, you know certain calls that you're going to get on a regular basis. Why, I had my prescription plan last year, and I just got this call today, but if it had gotten to somebody else, they would have told them the same thing. I didn't get a bill. I had a plan, and last year I know by this time I'd got my bill and paid it, and this year I didn't get my bill. Now that call came to me. He said he had called the company and he didn't understand what they were trying to tell him. I said, it's real simple. That plan doesn't have a premium this year, right? So you're not going to get a bill, But I mean, simple little things like that if that call had gone to a different route, then you would have never even had to come through to an agent because they're fully capable as well.
So when we call the health insurance store, our first contact will be with Denise, Deb, and Casey, and they will answer my question. Or again, they have to know the business because they have to know where to route the calls to.
Right. Absolutely, right. And then we have a system too where everybody, let's take Aaron as a prime example. Aaron's got probably logically more clients than any of us, right? He's been there, he's the owner, some people, whatever.
Yeah.
Well, Aaron can't take every phone call, and Aaron's not there every day. So we have agents who are assigned as a secondary agent, okay? And so I think I'm your secondary agent by your last name.
Yeah.
You happen to have a letter of your last name that falls into my jurisdiction, even though.
And we should, just in truth and honesty, Tony is the person I deal with at the health insurance store.
Right.
More often than not.
Right. So for stuff like that, and I think probably when you got your initial policy, Aaron's probably your agent of record, and that's all well and good. But there's a lot of things that outside of that first day when you did your enrollment, questions that you would have. So we just want consistency, right? So the system that they use is by the letter of your last name. You'll have your primary agent, but there's also going to be a secondary agent, because we don't want people to have questions, and every time you talk to somebody different. We want to establish that consistency. So that's why you and I, over the years, because of your last name, and since I've taken over whatever letters
I
you
have not made his life any easier, by the way. But
it's all well and good. Well, no, it's. I mean, I would treat you. I mean, I know you, but I treat you the same as I would everybody. Your questions to me are just as important as anybody's, no more, no less. But yeah, we do have that system, and then we also have, I guess they call it like a buddy system, that if somebody is off on a particular day, any of the calls. So sometimes I'll get Artrell is my buddy, so he has his clients, right? Artrell also has all the people that he's the secondary agent of, and then Artrell might take off. Well, if he takes off and someone calls in, then that call is going to come to me. So I mean, it's very well thought out. The whole thing is geared towards customer service, though.
now, when we called the health insurance store, the 724-603-3403, that is the central number. So will they also be able to direct us towards the proper office once we call that number?
Right. Yeah. So that's one of the things they're doing. They're screening those calls, especially if someone's new and is making an appointment. They're very good at making sure people know that we have multiple offices. I mean, if you're calling again, I mean, I have a 954 cell phone, so that indicates not that I live in Fort Lauderdale, but that I
nobody changes their cell phone numbers anymore.
So I've got that. So I mean, a 412 call doesn't mean it's a Pittsburgh client, but obviously they're gonna, once they get into gathering the basic information and finding out where someone lives, they're gonna. If that person didn't realize we had multiple offices, they're going to say, now listen, we have Connellsville and a Forest Hills office, and which one is more convenient to you? Or, they do a good job with that. Now, I always tease, because what do the people in North Huntington do, right? Because that's kind of like the midpoint. It's like, do you want to go to the city? Actually, I mean, the office in Forest Hills isn't what I would call the city. It's Yost Boulevard. It's right off Route 30. When I go there, I jump on Route 30 and just ride that sucker in.
Sure.
So, although you can jump off the Parkway and get there too.
Now, for those who are listening in West Virginia or the Panhandle of Maryland, if they call that number, are you licensed, and can you take clients from West Virginia or Maryland?
Yeah. So different people. I think Aaron says he's licensed in 20 different states. I have 3 different people. I think Artrell has more. I think most of us are all, clearly we're all licensed in Pennsylvania. I think we're all licensed in West Virginia, because obviously we're a border state. And then after that, maybe yes, maybe no. Again, I think Aaron is in the 20s. Artrell has quite a few. I do Pennsylvania, West Virginia, and Florida. Those are my 3. Because, I do the life insurance, and you got to draw a line somewhere.
Well, not only that, but with the internet, it's international.
Yeah.
So if you are watching on our WMES Facebook page, and a lot of people are, I tell you what, give the health insurance store a call, and they will tell you. and then they will give you all the information that you need. So we have the office in Forest Hills, we have the office in Connellsville, and do we need to go to the office, or can we do everything over the phone, or how does that work?
We can do a lot over the phone. We can do a lot through the powers of the internet, Skype, and we have a phone system called Ring Central, and whatever the other. There's very well established platforms that you can see who you're talking to and do screen shares. I mean, if I was being honest, I like as many face-to-face as possible. I'm more comfortable with it. Aaron, I think, because he does spend some time in Florida, probably does more of the video stuff than probably any of us. Phone appointments aren't bad. Sometimes when you get into the details of something, though, I like to just be able to show it to them on my monitor. I also, I don't know what it is. I'm Italian. I'm animated. I talk with my hands. If you're watching, you know that.
That's
I can't.
okay.
By the way, thanks for switching out. Last time I was here and I was in this chair, and when I went back and watched myself, I was making myself dizzy because I was just
Yeah, you were swiveling.
So when I sat down today, I'm like, good.
Yeah,
Maybe I won't look quite so silly, but
the next step is we strap you down.
Yeah. Oh, good. Well, that might not be a bad
So,
idea.
just feel comfortable. Nobody notices.
I mean, personally, I like a face-to-face. I write a lot of things down that I wouldn't be able to do if we were, doing a video chat probably. But we'll accommodate anybody in anything. I had a couple of months ago a client of ours, and I just felt like the only way I was going to be able to explain what I was trying to explain to her was to go see her.
Well, you can the eye contact. You can see when they get that glazed over look that you need to.
Well, this was no. So I'm on the phone with her, right? And I just knew the decision she was contemplating. I was like, I can't do this with her over the phone. And so I made an appointment to go to her house. And honestly, I know that it ended up being the right decision because her daughter, who's an adult, I mean, this lady was, I'm sure, well into her 80s, if not pushing 90, but she was definitely in her 80s. So her adult children are 65 years. They're on Medicare, right?
Yeah.
Like her children are on Medicare. So that she was old enough to be that. So she was probably definitely well into her 80s. And I said, I couldn't explain what I needed to explain to her and be confident that she understood me. So I made the appointment to go to her house. Her daughter showed up, and I could just tell by the feedback that I received that they just really, really appreciated that because she fully understood. I had met with mom at first, and then the daughter came in, and we kind of did a little recap. And the daughter had called me afterwards and thanked me, and she said, I should really appreciate that you would do that. And maybe we don't always have time to do that, but at that time I did, and so I did it. So.
Yeah, and also when it comes to the face-to-face visits, not only is it allowed but encouraged that you bring a family member, bring a spouse, or somebody who shares your interests.
Yeah, absolutely. I've had appointments where I basically have said it was just a gut instinct and intuition, whatever. Something told me that for sure that I was going to feel more comfortable if they had somebody else, someone who, a lot of times it's an adult child, but if they're giving me indications that person is active in decision making for them or active in their life to the point where I'm like, I don't want to make any changes unless, is there someone else that we can have in the room or at that appointment, just so they're hearing everything clearly. And we just want to help folks make the best choice for sure.
And if you want to ask a question right now on the Medicare A to Z, it's 724-438-4593, or you can give the call to the health insurance store directly at 724 603-3403, and also online at getyourbestplan.com. And well, you mentioned this earlier, and if we can't get all of it before we take a break, we'll continue in the next hour. But you mentioned Feel Good Friday story.
Yeah.
First off, what are your Feel Good Friday stories about?
So Feel Good Fridays are just examples of things that we've done, as the name implies, either that made us feel good. Typically it does. It makes us feel good, or that certainly we made a client happy. And just sharing. The other one that we do are the tips, tricks, and truths. But the Feel Good Fridays, it could be something as simple, like I wrote one time, Bill, because I felt good about it, right?
Yeah.
So what the client had been in, and it was something simple. Oh, when they were client, husband and wife came in, and he wasn't walking. I think he had something done recently, a surgery, maybe a hip or whatnot. And so I didn't know that till I visibly saw him, right? And it wasn't an especially nice weather day. And when they were leaving, it kind of crossed my mind to check in with them and where did you park, right? Because some people park close and other people don't know. So turns out they hadn't even parked on our street. They had parked in a parking lot on a different street. And I said, and I didn't know how they would respond to this. I just was being me. And I said, well, do you mind? Can I have your keys? Are you comfortable with me? And I said, well, I'll walk out with you to the front lobby here. You'll be able to see me. I said, I used to own this building. I used to load things I said, I'm going to pull right up on the sidewalk.
Yeah.
I know that we can do it. We won't get in trouble, briefly. And I said, do you trust me enough to, because I know where you're at and it's not good. So, and they gave me their keys. So anyway, I wrote about that. I'm like, hey, I felt good that I was in tune enough with him to know that he wasn't walking comfortably, to ask where that he parked, and then earn their trust enough that I could go get him a key. So that's the gist of those, right?
Yeah.
Bonnie, though, had written one, and I'm gonna read it. And she actually posted it, and then she posted some follow-up comments to it since then. But this just touches on just so many levels of customer support, and just showing just that the level of care that we just have for human beings, right? Not only so the things that you do that are a part of your job, okay, and then the things that you do just because you want to be a good human and you want to make someone happier, feel better, or go, what do we do that's above and beyond, right? So here's the one that Bonnie had written. I think I can read it without my glasses. It said, this is Bonnie's post. She says, I had a caseworker call me to inform me he had a client with only Part A and B, Medicare Parts A and B, because she recently lost her insurance. So the call comes, she had lost her insurance, she only has Medicare A and B. The client did call me. She wasn't sure what type of insurance she had, nor did she have her Medicare number. I called Medicare with her to get the Medicare number. So there's the first thing, right? Didn't even have her number. They call together, they get her number. And we ordered her a new card. Good. By getting this number, her Medicare number, I was able to find out what plan she had and when she lost it. So more information gathering. This is important, so I knew what plans she would be eligible for. Once this was done, we discussed her income. She is PACE eligible, so that her application has been submitted. Once approved, I can get her enrolled in the Medicare plan she wants. She was very upset and nervous about everything when we first started discussing this. By the end of the call, she was feeling like she would be okay. I told her it's my mission. This is Bonnie. I told her it's my mission to have her enrolled for February 1st, and I will get her in a plan. Sometimes just going the extra mile is all that's needed to give someone a peace of mind. And then I'm going to break that down a little bit, but then she did post a follow-up. She did get her approved for PACE or PACE-NET, which is pharmaceutical assistance for the elderly. We've talked about that before. And she posted that she is enrolled for a plan for February 1st. So there's a lot of moving parts there, right? Uh, but I mean, you have someone who's referred to you, they don't know, and this is not uncommon. She didn't know what her last insurance was. She didn't have her Medicare number. Like, so we have to get that information to start putting together the plan. And then once she had that, what did Bonnie have to do? Well, she had to get her enrolled in PACE or PACENet to create an enrollment period. So she did that, and then once she has the enrollment plan, then she can. So many levels of things that Bonnie that did there, and to me, I mean, I think running to get someone's car was nice of me, but I mean, this is a whole nother level of.
This is going to help somebody sleep at night.
She spent, I can guarantee you, she spent several hours from start to finish, at least, going over everything that she needed to do to get this lady set up, and I just, it was impressive to me, and I told her, I said, she sent it to me for some edits or proofreading, and it looked good to me, and I said, hey, I just want to let you know that's one of my favorite ones that I've ever read.
It is a great story. It shows, again, the lengths that you will go to make sure everybody has the right insurance. And again, one of the reasons Aaron started the health insurance store was to make sure people got the right insurance and not just something off the shelf.
Yeah.
And that is because you are not a captive agency.
Right.
So you can find the right plan at the right price. I guess it can happen that your insurance, sometimes companies just stop offering that insurance. They don't give you a lot of lead time, do they?
No, we run in, well, not only do I run into two scenarios that gives me two thoughts. One is that they didn't know that their insurance was going to end when it ended, or that their job. The other, well, along those same lines, we have a lot of conversations with folks that are planning for Medicare, right? And I'll have a conversation maybe my next appointment. Well, matter of fact, I think my next appointment is someone that's telling me that she's planning to retire in June. Okay, when I get back to the office, this is on my calendar. So we're going to talk about, well, if you retire in June, this is what you want to do in advance, and if you're going to leave work and you need a Medicare plan, these will be your options. So we're going to cover all that. But I'll have conversations with people all the time that'll tell me. So she might say, I'm planning on retiring in June, or let's push it out a little bit further. Let's say she says I'm planning on retiring in September, and I say, okay, when you retire in September, doesn't mean that 2 months later she might not call me and say, well, guess what? I say, what? Well, my position was terminated. I'm losing my. So even the best laid plans of mice and men, right? You're making a plan that this is what you think you're going to do, just like life, right? You think you're going to do something, and then suddenly you're not. This happens to people with their insurance. So we'll meet with somebody and we'll say, okay, if your timeline is this is what you should do and when, and then lo and behold, the timeline changes because the narrative changed, and they did lose the job or they did lose the insurance, and it's like, okay, well, now this is the new plan. It's really important. One of the things that Aaron stresses, and I think it's easy for me because it suits my personality well, is taking very good notes and documentation of the conversations that we have, so that when I talk to you about something now, if my next follow-up with you isn't until 3 months from now, I don't really, my first thing that I'll do is I'm going to say, now listen, we talked 3 months ago, and these are my notes, right? This is what we discussed. This is what we talked about. Has anything changed, or are we still on the same path? And, if it's the same thing, then we don't need to rehash it. But if there's a change, then we need to revisit the details. That just comes with experience and just learning to take good, accurate notes. We have a very good software system that allows us to do all that, all provided, by the health insurance store as a part of working there. I walked into a really good situation 4 years ago where having an insurance license, and you talked a bit about captive agent versus brokers, and there's different ways you can approach this industry. I also could have gotten licensed and decided that I was going to be my own boss. And some days, maybe you could convince yourself that that's what you should have done. But there's a whole lot of reasons that working at the health insurance store like I do was the right decision for me. And the biggest thing that I could never have recreated, and I've done it. I've done it in the mortgage industry, where in that same building, right, where I was working with some guys in Monroeville, friends of mine, as they had started a mortgage brokerage company. And so I went to work with them for a while, and then after a few months, they're like, well, we should expand and we should put an office, because they were down in Monroeville, Allegheny County. And I said, well, we should put an office in Fayette County. And of course, my hand goes up. Well, would you do it? And I said, yeah, sure, And so we did that. So, all right, this was 1999, right? So what did I have? I was in the same building that I'm in now, in the basement. Didn't own the building at that time. And so I'm renting space in the basement of this building. We've got a name. We've got a company name. Literally, I know, because there was a newspaper article done on me when I first opened. In the background, I have a typewriter sitting there, an actual typewriter, a couple of tables, a desk, I guess some sort of a computer, and a phone number. Right. So now I'm ABC Mortgage Company. Okay, but no one knows you exist, right? And so Aaron has talked about the days where no one knew he existed, and how did he grow the business? Well, here I am. He starts in 2008. I come to work for him in 2021, 13 years later. I'm plugged into something fantastic that he has spent time, and the Annettas of the world, and Lonnie, who was there in the beginning, and all these people that have come before me have done such a great job that I just get to sit down. And yes, now I've got clients who send me their friends and their relatives, and that's referrals, and that's repeat. That's all well and good, but you can have, on February the 1st, ironically, it was February the 1st of 1999 when I opened, the Connellsville branch of that mortgage company. No one knew I existed. Like, the phone didn't ring because no one knew I existed. So you advertise, you do this, that, and the other, but it takes time to grow a business.
And let's address something here, is that you may see ads for operations that look or sound like the health insurance store. Yeah. But the health insurance store, 15 years now?
2008. So
yeah, or more than that. Yeah, 2008. So yeah,
2008. Yep.
But anyway, they've been at it a long time. They've been there for all of the changes. You were there, or he was just starting up when the Affordable Care Act was being argued, and the changes in the business and everything that goes along with it. The folks at the health insurance store know this.
Absolutely.
Know it inside and out. And so, and again, I speak not because I'm sitting here co-hosting, but I also speak as a client who is very happy with the work that they've done with you. So that's a thank you. A lot. And hard though it may be to believe, we have already wrapped up the first hour of Medicare A to Z. Coming up in the next hour, we'll take your calls at 724-438-4593. And I know you wanted to talk about ordering off the buffet or ordering off the menu.
Yeah, you missed it last time.
Yeah.
You missed it, so I'm going to talk about that, and then the shell game.
And the shell game. That's all coming up in hour number 2 of Medicare A to Z, brought to you by the Health Insurance Store in Connellsville on your local station, WMBS Uniontown.
This is CBS News on the Hour, sponsored by O'Reilly Auto Parts.
I'm Matt Piper. Tariffs on hold for now, at least some of them. President Trump says he's pausing 25% U.S. tariffs targeting imports from Mexico for a month, as our Adrienne Bard reports from Mexico City.
Mexico agreed to reinforce its northern border with 10,000 troops effective immediately to help stave off fentanyl trafficking. President Sheinbaum said Mr. Trump agreed the U.S. would work harder to stop the trafficking of high-powered weapons to Mexico. On the trade agreement, she said the U.S. and Mexico created a new working group effective today.
Trump says he's speaking with Canada's Prime Minister next hour and with China within 24 hours. Tariffs against those countries are set to take effect at midnight. It oversees humanitarian and security programs in 120 countries around the world. But correspondent Cameron McCormick says U.S. aid is on the chopping block from President Trump.
Secretary of State Marco Rubio in El Salvador told reporters he's very troubled by reports the agency wasn't cooperating with the administration in its review of what was being spent.
Every dollar we spend and every program we fund will be aligned with the national interest of the United States. USAID has a history of sort of ignoring that and deciding that there's somehow a global charity separate from the national interest. These are taxpayer dollars.
Rubio will now be the acting administrator as the agency is merged with the State Department, and there will be significant job cuts.
Democratic lawmakers have protested the moves, saying Trump lacks constitutional authority to shut down U.S. aid without congressional approval. Now to the latest on the Washington, D.C. plane crash from last week. Crews have removed one of the plane's two engines and a large section of fuselage from the bottom of the Potomac River. Our Skylar Henry says the plane broke into at least 3 parts, and there are still bodies underwater.
There are still 12 remains that are still unaccounted for. Officials indicated yesterday that they believe that the removal of this wreckage could help divers and others find those 12 remains.
On the Philadelphia plane crash where 7 people were killed, the number of injured has just now risen to 24 people. 4 remain hospitalized, 3 of whom are in critical condition. Super Bowl 59 is Sunday in the city of New Orleans. Mayor LaToya Cantrell says they're ready.
We know that we're built to host. We know that we're second to none when it comes to our culture and just the magic that this city has to offer.
And it marks the 11th time the city has hosted the event. Get your Cowboy Carter boots out.
Now we need all the cowboys to dance.
After her big night at the Grammys, Beyonce announces her Cowboy Carter tour. The 22-stop tour kicks off April 28th. In Los Angeles. This is CBS News.
Think O'Reilly Auto Parts for all your car care needs. Get the parts and service you need fast from the professional parts people at O'Reilly Auto Parts.
This is Eric Cushy from Curtis Pharmacy. We don't sign every insurance contract out there. We don't participate in every network. And what we've come to realize is if we take our invoice cost on generic drugs, add a fair dispense fee, we can save you money depending on the medication. No insurance, no middlemen. You have a prescription, you pay us, you're done. If you take generic drugs, this program's for you. Go to our website at curtispharmacy.com, click the Dare to Compare link, and feel free to look up your medication, see how much we could save you.
Looking for a healthcare provider that puts you first? Montgomery Medical is now accepting new patients. We proudly accept Highmark Medicare Advantage plans and many other insurances to make care easy and accessible for you. As a locally owned family medicine practice, we treat every patient like family because you are family to us. With extended hours and a commitment to your health, we're here for all your needs from checkups to the unexpected. Call today to schedule your appointment or a same-day appointment and join the Montgomery Medical family. Montgomery Medical, a family tradition of family medicine.
Happening today, the case between a couple of Hollywood actors heads to court in New York.
But 15 seconds, that's all it takes to completely change everything.
It'll be the first hearing for feuding It Ends With Us co-stars Blake Lively and Justin Baldoni. She accuses him of sexual harassment and orchestrating a smear campaign. Baldoni, who denies it, has sued Lively and her husband Ryan Reynolds for defamation. Lively is expected to ask a judge to dismiss Baldoni's countersuit against her and request a gag order to stop his attorneys from releasing behind-the-scenes footage from the movie shoot. A trial is scheduled for March of 2026. Deborah Rodriguez, CBS News, New York.
Reports from across the pond are that Kensington Palace is going to cut back on naming the luxury labels Princess Kate wears. The Sunday Times says Kate was frustrated that too much attention was being paid to her attire and not to the issues she's highlighting. Matt Piper, CBS News.
Now the local, district, and statewide news. Being brought to you by Fayette Heating and Air Conditioning, your Bryant Dieter. Keeping you warm and cozy in winter and cool and comfortable in summer with a quality Bryant gas furnace or air conditioning system. And now the news.
Good afternoon from the Davis & Davis studios. Davis & Davis attorneys at law voted Fayette County's best law firm 2024. your local station, 590 and 101.1 WMBS on this Monday afternoon. I'm Nick Barczyk. It's 2:05. We are looking at 61 with sun, a beautiful spring-like day, on the way down to 41 this evening. Much more on the Weather Watch and the sports in just a bit. Federal immigration agents took a man into custody outside the Fayette County Courthouse last week. The man, identified as 28-year-old Marco Antonio Gomez from Connellsville, was arriving at the Fayette County Courthouse on Main Street in Uniontown for a hearing on a pretrial program for first-time DUI offenders. He was taken into custody without incident. Fayette County officials say no one else has been detained in the county so far. Washington County officials say the number of people who were homeless last month was almost double the count from last year. County officials say they believe the actual number was up because the count was done during one of the coldest nights of the year. Volunteers counted 20 people living on the streets, with most living in the city of Washington. The year before, it was at 11. A Donegal Township man faces multiple counts of insurance fraud and theft on accusations that he scammed 2 insurance companies on separate occasions with false claims totaling more than $30,000. Authorities say 45-year-old Walter A. Smith Jr. was charged over the weekend by the state attorney general's office. Triple Live reports Smith faces 8 counts of insurance fraud, 4 counts of theft by deception, and 4 counts of attempted theft by deception in a scheme in which Smith is alleged to have sought payment for the same animal scratches on his 2015 Nissan multiple times in 2023 and 2024. 14 of the 15 charges filed against Smith are felonies out of Westmoreland County Court. The developer that just bought the Monroeville Mall plans to make it a destination complex with retail, entertainment, restaurants, hospitality, and office spaces. Officials with Cypress Equities say the buyer is planning to bring what they call a new vision of the mall, which opened in 1969 and was renovated in 2003. The Monroeville mayor says he's optimistic the plans will have a very positive effect on the area. More next on WMBS.
439-2323. For 24-hour emergency service, call us when you need. We're Fayette Heating and Air Conditioning, your service company.
Be prepared for bone-chilling winter weather. Have Fayette Heating and Air Conditioning install a Bryant high-efficiency furnace in your home to replace that old worn-out system you now have. Choose Bryant's Plus 90 gas furnace or other quality heating system to keep yourself and your family warm and toasty this winter. Fayette Heating and Air Conditioning will also keep your present furnace running at peak efficiency with their 15-point safety check and cleaning. Call Fayette Heating and Air Conditioning today for your appointment. 724-439-2323. That's Fayette Heating and Air Conditioning, your Bryant dealer, Route 119 north of Uniontown, located near Laurel Mall.
Call Fayette Heating and Air Conditioning, 439-2323, 439-2323, 439-2323, 439-2323.
It is 9 after the hour, and Matt Mattinson now with the latest technology news and some of the news coming out of Southwest Pennsylvania.
More and more companies like Amazon, AT&T, and Dell are requiring people to return to the office this year. Tammy Trujillo has more.
But recent research shows that return to office orders can cause even the best employees to quit. A survey by the Pew Research Center involving over 5,000 people found that almost half of hybrid and remote workers say they're unlikely to stay at a job if they have to be in the office full time. And research from ZipRecruiter suggests that companies looking to dramatically scale back on hiring are more likely to enforce RTO orders. Meanwhile, researchers at the University of Pittsburgh found the turnover rates are especially high among women, senior, and skilled employees.
OpenAI is launching ChatGPT Deep Research. The new AI agent can conduct complex research in fields like finance, science, policy, and engineering and deliver a complete response in 5 to 30 minutes. And Bloomberg reports Apple iCloud users will soon be able to invite people to parties, events, and meetings. Codenamed Confetti, the calendar app will likely be wrapped into the iOS 18.3 update. Tech Report, I'm Matt Mattinson.
In sports this evening, we bring you high school basketball, girls action, Manessa and Agaibo on the air at the Sprouse Insurance Group pregame at 6:15, and the game at 7 this evening, another C.R. Barado Group High School Sports Night on WMBS.
The local, district, and statewide news has been brought to you by Fayette Heating and Air Conditioning, your Bryant dealer. Route 119 north of Uniontown, located near Laurel Mall. Phone 439-2323.
The Weather Watch is being brought to you by State Farm agent Nathan Ferguson. Call Nate at 724-438-7611 for life, home, car insurance, and more. Get a free quote now. Just a beautiful day on this first Monday of February. And right now, and maybe 6 more weeks of winter, according to Punxsutawney Phil, but we're not feeling it today. sunny and 63. Feels like we're in the mid-50s, but still just beautiful. Overnight low down to 40, only going up to 43 Tuesday. Low tomorrow night at 27, 43 on Wednesday. Thursday at 57 and 43 on Friday, with a chance of some rain and some light snow. Rain more likely Saturday in the afternoon, going up to 49. Overnight low at 37 and some sun on Sunday, but only going up to 41. But right now, the warmest day in a while at 61 at 2:11 on this Monday. Good afternoon from the Davis & Davis studios. I am Nick Barczyk. On the way next, the second hour of Medicare A to Z. And that's on the way next, 724-438-4593, live on WMBS and on Facebook Live. Good afternoon.
The Weather Watch has been brought to you by State Farm agent Nathan Ferguson. Nate is there for you. Call 724-438-7611 for life, home, car insurance, and more.
Looking for a healthcare provider that puts you first? Montgomery Medical is now accepting new patients. We proudly accept Highmark Medicare Advantage plans and many other insurances to make care easy and accessible for you. As a locally owned family medicine practice, we treat every patient like family because you are family to us. With extended hours and a commitment to your health, we're here for all your needs, from checkups to the unexpected. Call today to schedule your appointment or a same-day appointment and join the Montgomery Medical family. Montgomery Medical, a family tradition of family medicine.
Tune in to WMBS on Saturday mornings at 8:20 a.m. for a new program, Your Financial Future, with Gary Boatman, certified financial planner, investment advisory representative, author, and syndicated columnist. Providing educational advice to his audience and readers, Gary Boatman addresses such income issues as planning for retirement, future healthcare expenses, avoiding financial pitfalls, and much more. That's Your Financial Future with Gary Boatman, Saturday mornings at 8:20, right here on WMBS.
Super Bowl 59 is on Westwood One.
The Philadelphia Eagles are headed to New Orleans.
Now the Chiefs are on the doorstep of history, going for a third consecutive Super Bowl.
Hi, everybody. I'm Scott Grant. Join Kevin Harlan, Kurt Warner, Laura Oakman, Gene Steratore, Devin McCourty, and me for all the action right here.
Our Super Bowl coverage starts at 5 p.m. Sunday, February 9th on your home for the Super Bowl, WMBS.
Attention, residents of Fayette County. Don't miss your chance to see preservation in action at Frank Lloyd Wright's Falling Water, a world-famous work of architecture that's on the UNESCO World Heritage List, located right here in Fayette County. Falling Water invites you to Fayette County Appreciation Day on Sunday, March 23rd to see a multi-year historic preservation effort in action, in addition to the always breathtaking home itself. Falling Water is offering free tours for Fayette County residents to take preservation in action tours on Sunday, March 23rd. Book your free tour of Falling Water in advance by calling 724-329-8501. Falling Water's Preservation in Action tours will take place between 9:30 a.m. and 4 p.m. on Sunday, March 23rd. Be sure to make your reservation in advance and don't miss your chance to witness this once-in-a-lifetime preservation tour of Frank Lloyd Wright's Falling Water, a world-famous work of architecture located right here in Fayette County.
You can go to Big Box Medical Office.
Now serving number 3,943.
Or,
hi, come on in. How are you feeling?
when you see doctors Paul Hartley and Mary Beth Riley, plus nurse practitioners Tara Bozek, Jessica Reckart, and Stacy Morris, you get one-on-one personal professional health care serving the area for over 3 decades. If you're looking for a primary care doctor, call Doctors Hartley and Riley at 724-437-1109 or online at ppcp.org. Or
serving number 3,944.
Having Hicksonbaugh's Drugstore in Uniontown means reliability, quality, and service. Pharmacists Stephen Harper and Seth Miller fill your prescriptions, offer free prescription delivery, mail-out service, and gladly answer your healthcare questions. Flu shots, the new Moderna COVID boosters, plus Shingrix shots with your doctor's prescription are also available at Hicksonbaugh's. Call 724-437-2828. Hicksonbaugh's Drugstore, 304 Morgantown Street. Open Monday through Friday, 9 to 6, Saturday till 3, closed Sunday.
Your local station, WMBS.
The views and opinions presented by the host, guests, or callers on this program do not necessarily represent the positions of WMBS Radio.
The information you will hear is general information about health insurance. If you want specific health insurance advice, please call the Health Insurance Store at 724-603-3403. The host or guest may not be able to mention specific health insurance companies. You cannot change, purchase, or bind any insurance policy over the radio.
And this is hour number 2 of Medicare A to Z, brought to you by the Health Insurance Store, 121 Pittsburgh Street in Connellsville. And you can call them direct at 724-603-3403. And Tony DiRoma is here. Aaron is away today, so we've been going over quite a lot of stuff about the Health Insurance Store. And if you have a question you'd like to ask Tony, he also is their life insurance specialist at the Health Insurance Store. You can call us on the air at 724-438-4593. And Tony, as we wrapped up the last hour, we talked about something that you call buffet versus ordering off the menu.
A la carte, yeah.
What would that be all about?
Okay, so I last time was on with Brian. I unveiled this for the first time on the radio, and I said it might be great, it might be terrible, but it is what it is. And this is something that for the first time, and it wasn't rehearsed. It happened organically based on a question that a client or a caller had asked me one time about a particular way of understanding the way their coverage would work. And I gave an explanation that I had never given before. And I said this even in the first hour. A lot of times we give the same information over and over, understanding, of course, that if it's the first time you've ever heard it, then it's still valuable information. But, after a while, I guess you just, I don't know, out of nowhere, this illustration came to me and had never seen it in writing. I never heard it from anybody else, but I used it in that moment and it made sense to the person. But when I left and I told you, this is what I think about, oftentimes what I dream about, right? And after I had given that explanation and I really started to think about it, I realized it had more broad applications than even what I had brought out to answer that one question. So then, since then, I've introduced it and I've discussed it with some people, and so far the feedback has been good. So thank you for the opportunity and I'll give it to you.
Right.
And if you don't mind, you've talked, I think, before about being a client at the Health Insurance Store. You have a Medicare supplement,
right?
And you are a person who, in the past couple of years, has gone through some stuff, medically speaking. Nothing there that I can't say.
No, nothing I haven't talked about before.
Right, so I don't want to make you uncomfortable, but those are things that have all been established. So when I do this, I'm going to plug you in, or you tell me where you plug in. Okay. I think it'll be pretty obvious.
Yeah.
So it's just a different way of thinking about Medicare supplements versus Medicare Advantage plans, and then depending on which one you have, a different way of thinking about how you might be covered in certain situations, okay?
Right.
So the first one will go into a restaurant. So I'll say, listen, let's, instead of talking about all this stuff we're talking about, let's just pretend we went to a restaurant.
Okay.
And when you walk into the restaurant, you see that they offer a buffet,
right.
Okay? So
my eyes line up, by the way, but go
well,
ahead.
Clearly they do,
Yeah.
Because I would maintain that this is the health care that you've chosen.
Right.
What is a buffet? When I say a buffet, and we can talk about this, when you order the buffet, you're going to typically pay a higher price, right? Because it's, for the most part, all inclusive.
Right.
Okay, so when we have the Medicare supplements, we know that comparing to Medicare Advantage plans, we're paying a higher monthly premium, right? But we also know that when we order the buffet, we can eat as much as we want, and we're not really affecting the out-of-pocket, right?
They don't charge more if you go for a second helping.
And thirds and fourths, right? So wouldn't you say, in a way, that you have, and there's another outcome. Well, let me give you the other outcome first. So the other outcome is, and I always like to pick on my wife. After 30-something years, I mean, we're secure enough that
she's used to it.
Yeah, and I'm going to do it later too. So twice I get to talk about her, just for illustration purposes. Although there's probably some truth to both of these scenarios. Let's say you take someone, now you're on a date,
right?
And I go and I bring my wife to the same restaurant, and we both order the buffet. Right about the time that I'm ready to go up and make my second plate of food, if I look at her and I'll be like, let's go get some more. What happens if, and potentially, she looks at me and says, I didn't really see anything up there I liked.
Yeah.
What am I going to say? But, hun, I got you the buffet.
Yeah.
You've got to eat.
Right.
Okay? So let's put that in terms of medical. If you have a Medicare supplement, I would maintain you've bought the buffet.
Right.
And if you've bought the buffet, and God forbid some things happen, like you've gone through, right? You, I would hope, had at least the peace of mind of knowing that beyond your monthly premium, which admittedly was higher than if you had taken another option, you knew that you weren't going to, no matter what kind of treatments you needed, face much more out of pocket beyond. I mean, there's a deductible and maybe some small copays, but it's not a fixed price per se. But you knew that your bill wasn't going to continue to get driven up and driven up and driven up if you needed more and more and more.
And
right?
so I was able to go back to the buffet.
Yep.
And get more without the price increase.
Without worrying what you're going to pay, right? However, and I get these calls all the time. I'll get these calls from people like my wife who possibly ordered the buffet and then didn't eat very much. What's that? That's the person that 2 or 3 years after taking their supplement calls me and asks me to remind them why did I tell them that I thought they should have taken a supplement. Because they'll say, well, my premium possibly by then has already gone up, and even if it doesn't, I know comparing to my friends who have a different type of coverage, which we'll talk about, I'm paying more per month, and I don't really think the plan is doing anything for me. And then I'll usually say something along the lines of congratulations then on your good health, right? Because if you haven't met Medicare's deductible on a Medicare supplement, the Part B deductible for the year, until you do, the supplement company doesn't pay anything on your behalf. Okay, so what's that the equivalent of? I ordered the buffet, but I didn't eat very much. I wasn't a consumer of a lot of medical services. The beauty of it, though, would be that as long as you're in that restaurant and you haven't left for the day, or as long as you're still enrolled in that Medicare supplement plan, if your situation changes and your appetite grows, or you need suddenly to go from not needing many
they brought
services.
out the potato soup. Here we go. Yeah.
That's right. So what's it? So now I've been healthy, but I kept my supplement, and now all of a sudden the next call is, I'm sorry to tell you, but it's such and such. As long as you're still enrolled in the supplement, as long as you're still paying for that buffet price, nothing to worry about. Okay, so that kind of makes logical sense.
It makes a ton of sense.
Different way.
And then, so the Medicare Advantage would be the equivalent of ordering off of the menu.
Ordering off the menu, but I'll maintain there's 3 different ways to look at that too. Because when you have a Medicare Advantage plan, there are things such as your PCP, your primary care provider, or maybe lab work. There's a number of things that are either free or so inconsequentially inexpensive that it would be along the lines of going to a restaurant, same restaurant, I'm not ordering the buffet, I'm just going to order off the menu, but you're not hungry. And so you say, give me a French onion soup. Right. Give me a side, don't even give me the chef salad. Just give me a side salad and a cup, not a bowl of soup, right? We get a couple of little inexpensive things, we pay for those things, and we move on. That's fine. Sometimes, Bill, we go to a restaurant, we're a little hungrier.
Right.
We don't want just a cup of soup. That's me all the time. I never just want a cup of soup. Nor do I ever order just a cup of soup. But I'm always
might as well have a thimble full of soup.
Yeah. But I'm gonna probably order a meal.
Right.
Maybe it's whatever. It's the pork chop and the meat and the potatoes and the vegetable and the side, whatever. So in the world of Medicare Advantage, I talk about things that would be the equivalent of being in that restaurant and ordering a meal. Things that are pretty equally priced from one company, basically, or identically priced from one company to another. A trip to the emergency room, maybe an MRI, maybe an outpatient surgery, right? Things that aren't like, I'm not even going to have to think about this amount of money, but I'm also not going to go into full on, oh boy, wait till I get that bill, right? It just, I went out and I got a meal. So there's that.
Also, sometimes they throw in extra stuff when you order off the menu.
True.
Like a pack of saltines and free refills on the iced tea.
There you go. Sometimes you get those freebies in there.
Yeah.
But what's the other thing? So I went in with a little appetite. I got something small. I went in on a normal appetite. But what happens, and when we talk about Medicare Advantage, I do my best to, and it's pretty easy to identify. There are certain things that if you need, certain services that if you need them and you're ordering off the menu and you need these things, it would be the equivalent of prime rib. Maybe it's surf and turf or the biggie, and there's a handful of them that are the medical equivalent of market price.
Right.
All right. Did it once in my life. Was feeling cocky, was feeling brave, and
I'll have the lobster market price.
Market price, and then on my dad's advice, one of the things he taught us, he said, if you have to ask the price, you can't afford it. And I'm like, okay, I don't want to send this. I don't want to send. I'm in this very nice restaurant. I don't want to send a signal that I probably, maybe necessarily can't or don't want to afford this. So it's market price, and I just ordered it, right? But eventually they're going to bring you the bill, and you're going to find out what market price means. So there are things on Advantage plans, and I'll very clearly identify them. If you need this or this or this, then you're going to be paying a co-insurance. So it's not a set co-payment, it's a co-insurance. And I can't tell you, nor will you know before you have that service done, what the actual charge will be. That's what market price is. And so we either go in the restaurant and we order the buffet, we eat a little or a lot, or we order off the menu and we go anywhere from an appetizer to a meal to potentially that market price item. And it's the same in Medicare supplements and Medicare Advantage plans. And there it is.
And if you want, again, somebody who knows the difference, give them a call at the health insurance store.
Now, I promise you, I'm the only one there that will explain it to you that way.
Right.
So you either like it or you don't.
Until somebody steals your idea.
Yeah, well, if that happens, then...
Yeah. Let's check Aaron's next call. Anyway.
No, it literally, Bill, I'm telling you, it was just a question that someone asked, and I answered their question with a piece of that analogy. And then when I went home, I couldn't get out of my head. I'm like, what, really? It's bigger than that. It checks all the boxes. And so I started using it. And for the most part, either people are just being nice to me or not. But most people that seems to resonate with.
And sometimes, after you've had the buffet for a while, you say, I can switch over to ordering off the menu too, and you can go do that as well.
But sometimes you start ordering off the menu, and then you decide you want the buffet, and you can't always get it.
Yeah, especially once you've ordered the meal in the restaurant, they generally don't like you going up to the buffet.
Just think about this. Oh wow, this just blew my mind. Let's say you were mind blown. Let's say, maybe I'm just impressing myself. Let's say you were in a restaurant.
Yeah.
You think about this. You were in a restaurant and you were hungry, so you ordered the appetizer, you ordered the meal, you ordered the side, the extra, you couldn't, after having ordered all that food, go to the restaurant, even if they offered a buffet, and say, "Well, just convert this over to the buffet," right? No. They might. I mean, I guess it would depend. But in reality, it's kind of a similar scenario. They might tell you, "Well, there you go. same exact scenario. They might say yes,
Yeah.
but they might say no. And that's the thing. Same with starting with an Advantage plan and trying to get to your supplement. Maybe you'll get a yes, maybe you'll get a no.
Again, if you have questions about supplements and about Advantage plans and anything, and buffets, that would be my expertise. But anyway, you can give us a call right now at 724-438-4593, and we'll take your questions on the air, or we are live streaming this on our WMBS Facebook page if you want to ask a question there. And if you want to call the health insurance store directly, it's 724-603-3403, or go on to getyourbestplan.com. And if I remember correctly, you can send a message, and I think you might be able to schedule, but you definitely can send a message through the getyourbestplan.com website.
You can. They monitor that. I know that Aaron gets them, and I know as far as the admin side of it, it must be Jennifer, because every so often Jennifer will come in or forward an email and says, this is yours. So those get handed out on a rotation. Just like phone calls, Bill. I remember I told you there's a system for everything.
Right, yeah.
Just like a phone call that comes in where there's no established agent, there's some chart. I'm not privy to it, or if it's there. I just wouldn't even know how to do it. They have a system of knowing that, well, the last person that called in that wasn't referred or blah, 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 and needs an appointment, it gets and hasn't asked for somebody specific. There's a rotation of people that those go out to.
So you will get a qualified person who, and again, having done this show with Aaron for several years, one thing I know is not only are you trained before he or puts you at the front line, but you're constantly getting retrained and retested.
Yep, retrained, retested, certified annually. Every 2 years in the state of Pennsylvania, you have to have enough continuing CEUs to continue your licensing. I do an extra one for life insurance. They call it AML, which is anti-money laundering. Right. So I just had to redo my AML because as a part of the Patriot Act and a couple of pieces of legislation, there are some specific things that as a life insurance agent that we're supposed to be in tune with and aware of because life insurance can be used in certain creative ways to launder money, to take clean money or dirty money and make it clean. And so there's certain indicators and things that we're trained on that if you ever run into this scenario, what's the protocol? Who do you contact? What do you do? That type of thing. I want to say, too, not only is there a system of when someone calls in, but we are now back to, we were not doing this during the open enrollment periods, but now that those have come and gone, we started back either last week or the week before because we do want to accommodate anyone as best as we can, and sometimes people just stop in. People maybe wanted to call and couldn't find the time to call, and they realized they had the day off or a spare hour, and they were driving by, and that question's been bugging me, and there's the health insurance store, and they pull in. Ironically, this past Friday was my walk-in day. So we do have at least one agent every day this time of year who does not schedule appointments, although you can do an appointment here or there. But for the most part, we're not scheduling appointments because we're keeping our calendar open in case someone were to walk in so that they could be taken care of immediately. And this past Friday was my walk-in day, and I have to laugh. Actually, right off the bat, lady walked in. Tony, you've got to walk in. Okay, come out, introduce myself. We go back. While I'm meeting with her, I get a message from Deb out front. You've got another walk-in. And my first thought was, well, Am I the only, like, is everybody else in an appointment? I said, I just wanted to make sure that the person wasn't waiting. And then she said, no, he said he would be fine to wait. I'm like, okay, that's fine if he wants to wait. And so I finished up the appointment, said goodbye, clear off my desk, and I go walking out. And as soon as I get into vision, I see the person and I know them.
Yeah.
And he knows me.
Right.
Didn't know that I worked there. And so he starts, oh no, anybody but him, anybody but him. the look on Deb's
So apparently
face.
he did know you. No.
Deb gets this shocked look. I'm like, he's teasing. I said it actually ended up being my wife's cousin, so somebody that I know.
Yeah.
But he didn't know, and that's the store's been there since 2008. I've been there for 4 years. He didn't know that I did it, and why was he there? Because he's thinking he might potentially consider early retirement, and he wanted to know if I do, what are my options? So,
So the good news here is that if you are there in the neighborhood and you want to walk in, you will be helped at the health insurance store at 121 Pittsburgh Street in Connellsville, or again, call them at 724-603-3403. And if you have a question for Tony here and you want to ask it on the air, 724-438-4593. Well, we're going to go do a little Price is Right. We've done the grocery game.
Exactly what I was going to say.
And now we're going to do the shell game.
The Bob Barker version.
Yeah.
I know the Jim Carrey guy and whoever else does it now. I grew up watching Bob Barker, and you can't beat Bob Barker.
And the shell game with the little ping pong ball under it. Anyway, but you did want to talk about something you call the shell game. What is that?
Shell game and buckets, and so this is just another analogy that I organically came up with. And again, if you like it, great. If it doesn't make sense to you, then just go back to the other stuff we've been telling you since 2008.
Go back to the restaurant.
You go to the restaurant. But this speaks specifically, Bill, to Advantage plans, Medicare Advantage, Part C of Medicare. So supplements are not in this conversation.
Right.
Okay? This is just a way to try to help streamline a little bit people's thinking, because it can get a little overwhelming. There's whatever, depending on your zip code, probably 50 to 60 plans to choose from every year, from a number of different carriers, all of whom we're licensed with. But we have learned over time, which companies and which plans tend to work the best, especially here in, Western PA for sure. And so this is just a way that I, use to explain, or just to clear the thinking a little bit. I'll tell people, and I'm usually drawing this on my desk, but I'll just give it to you visually. So I'll tell people, imagine that there are 3 buckets, okay? And in the first bucket, I'll just start listing off PCP, ER, emergency room, inpatient, outpatient, MRI. I'll say these are the things that every Medicare Advantage plan is required to cover because Medicare says so, okay? And I think maybe there's 23 of them. I don't know. That's the number that comes to my mind. I don't typically quote that number, but that's the number that I saw. So maybe that's what it is, hopefully something in that range. But here are the things, right? Medicare says that these plans have to cover those things. So every plan covers everything in that bucket,
right,
with slight variations. Maybe on this plan, a copay for this service is $10, but on this one it's $30. But the one that has the $10 copay has the higher max out of pocket. But they all cover all the things they have to. If we get into the from my other analogy, if we get into the market price things, the things that can be expensive, guess what? They all cover them identically.
Right.
So all the things that could be expensive are covered identically, and then most of the other things are covered very, very similarly, plus or minus a couple of dollars either way.
But they will involve things like copays, like minimums out of
right,
pocket.
Copays and coinsurances and the max out of pocket. But all that stuff from plan to plan, even within the same company, they're all going to cover everything they have to, and they're going to do it more similarly than different. Slightly variation, but all going to cover them. Then we have a bucket that I just write RX on it. So these are your prescription meds. Okay. How are your prescription meds going to be covered on this plan or this company versus that one? Okay. And clearly, especially this year, we see probably more variance than ever because we have a new set of rules in 2025. And we literally have had people during the annual enrollment and the open enrollment periods, we've literally had people that we have changed plans based solely on their coverage of their prescription medication. So that bucket was important to them. And then there's another bucket. I say, here's the third bucket. And I don't know which ones I'm allowed to say, so I'm just going to call it the extras. Right. You might get coverage for something involving your teeth or your eyes or whatever, right? Maybe it'll help you keep fit. And so we have these ancillary benefits, these extras that we try not to get into too much particular about, but there are extra things. So then I'll usually make a joke like this, but it's true. Different people will shop out of different buckets, okay? So if I'm going to buy a car, if you're going to buy a car, what's the top 2 or 3 things you would ask about?
Gas mileage.
Yep.
Warranty.
Yep.
Is it a 6-cylinder, a 4-cylinder?
Right.
Yeah.
Same 3 things I would say. What's the gas mileage? Is it a 4? Is it a 6? Is it an 8? Whatever. And what's the warranty? Yeah, that's the important. So that to me is the first bucket, right? The nuts and bolts of it, right? Are my providers accepting it? Can I see the doctors I went to, the facilities that I went to? That's what I would be focused on. My wife, the one who doesn't order enough at the buffet, would likely go in and say, what color does it come in? But more importantly, where are the cup holders?
Yeah.
Right? Because that's important to her. Yeah. She, I would maintain, is shopping in the bucket of extras. Right? Those are the things that wow her. A little higher allowance in one particular thing might make that plan more attractive than another plan.
And again, like buying a car, depending on how many extras you have or don't have, can affect the price of the car.
Exactly.
As well.
Yep. So then I'll say, so if we have these 3 different buckets, and then if we had on my desk a big pile of balls that represented all of the money that the government was paying to this company for you being enrolled in this plan, plus, if they're charging you something, we'll throw those a couple of dollars. They could be dollar bills. They could be dollar bills or red balls. In my story, they're red balls because I think that's what Bob Barker used. And then I said, let's take a shell and put a certain number of balls under each shell. And then let's line a shell up in front of everything that it has to cover, right? All the extras. Let's put some shells in front of prescription drug. Let's push some shells down here in the extra. Now, we don't know how many balls are under the shell at this point, but we put a shell in front of everything that had to be covered plus everything else that they do cover, the extras in the prescription. And then I said, now let's just switch them all around the board. And when we open up this shell, we say, ooh, max out of pocket's a little higher on this one, or ooh, the copay's a little lower, or ooh, this one has a little more dental or vision, whatever, right? And then I'll say, they're really just different versions of the same thing.
And so basically shop the way for what you are looking for, and that does include the price.
Right. That's a part of it. But we're gonna walk someone through it. We don't want someone to pick a plan because their friend had it and they had a very generous allowance on an ancillary benefit without going to my bucket and saying, yep, that's great. Does your PCP accept this plan? Or what's the max out of pocket on this plan? Or what's the cost if you're hospitalized on this plan? Don't get necessarily distracted by this bucket. And by the way, did you know that based on your medications, that's a terrible plan for you and that this one would have covered you way better? And that's a part of what we do, and on your left on your own, potentially you might be shopping for what we would consider, even if it's not the wrong thing, we just want to make sure that people understand, hey, if that's the most important thing to you, yep, no one will give you as much of that as anybody else. However, now you're exposing yourself here, and here. And we just have an adult conversation about it.
And also, one of the things that they will not do at the health insurance store is make you take the clear coat and the floor mats.
No.
It's because you are not captive, you can find the best car, figuratively speaking.
Yeah, and we don't. That's true in Medicare. It's also true when we do the Obamacare, the ACA plans through the Penny website, right? Some people are paying very, very little for those plans. Other people are paying substantially more. When I walk through, that would have been a good one to do too, but we don't have time. When I walk through, I usually, when I'm doing a consultation for someone who's about to pick a plan, I usually tell them, this is what we're going to see. I like to explain to them what we're going to see before we see it, so that when we see it, it's just validation of what I already said. That's just my way of doing it.
Right.
But I do explain that if I'm recommending this plan, which happens to cost potentially more than this plan, I'm not doing it because it's going to affect my paycheck.
Right.
Okay, there's no incentive for me to sell you a particular plan, and I wouldn't pick on any other industry, but I'm sure there are industries where the price of that vehicle affects your commission. And I make sure that people are crystal clear on that's not the way it is, and that's not what we do, and that's not how it even works. If I'm recommending something or pointing out the possibility of enrolling in something that might happen to cost more than something else, then I'm also going to explain to you why is that plan cost more, and is the additional cost worth it to you or not.
Right.
The way I explain insurance is I tell people the textbook definition of insurance would be the transfer of what? Fill in the blank. What are we transferring? If you purchase insurance, what are you transferring? Do you know?
Risk.
Risk, right. It's a good risk transfer,
Yeah.
right? And although there clearly are exceptions, some of the Medicare Advantage plans are a great example of an exception. For the most part, and sometimes this holds true, other times it doesn't. But what do people have ingrained in their mind? You get what you pay for.
Right.
Sometimes there are, again, exceptions to that, and if I believe there are exceptions to it, then I'm happy to explain to them. People will literally call Bill sometimes, and they'll say, especially this is an Advantage plan person, the Part C, and they'll say, well, I have this plan, and it's costing me X amount of dollars, and whether we help somebody enroll in it or not, in this scenario, let's say we didn't. And they said, well, I bought this plan a couple of years ago from somebody, and it cost this much. And then they'll say, but I want a better plan, so I'm willing to spend more money.
Right.
And a lot of times we'll tell them that's not. Sometimes that's true, but oftentimes it's not. It's like, actually, you could spend more, but you aren't necessarily going to get a better plan.
Yeah.
So, but we know this is what we do. If there's an exception to the rule, we're going to say this is an exception. If it follows the rule of this plan costs more because you're transferring more risk, if this or this or this were to happen, then we're going to explain to them why it costs more and what the additional risk is that they're taking if they don't pay more, and then just let them decide. Again, at the end of the day, we're all adults.
And we are on the Medicare A to Z, brought to you by the Health Insurance Store, 121 Pittsburgh Street in Connellsville. Call them at 724-603-3403. We've got about 10 minutes left. I think we have enough time to go over a question that you have brought,
Yep.
that Heather sent to us. So what is Heather wanting to know?
So this is one of, it's either this week's or last week's, possibly. It's one of the last 2 weeks of questions that were sent to Aaron, who he turned into an article, right? So by taking questions that we get, this is a great way to learn, by the way, too. This is the same thing that I do on social media. I read scenarios that other agents are saying, this happened, what would you do, right? Because I want to try to have already thought about it before someone says it to me.
Right.
So when you read these things from Aaron, potentially they're you in the future, right? So it's a good way to just kind of prime the pump that if I ever find myself in this situation, I've already got a bit of an idea of what might work best. Now, obviously, you're going to call us anyways, because as he writes at the end of all these articles, my advice in this column is not a substitute for a full consultation. So obviously, we want people to come in and get the full consultation. But I'll read through. This was a question from Heather, who had written this question, probably emailed it to Aaron, and then I'll just read through his answer. I'll probably just try to read it through, and then maybe we can pick out certain points of it. Heather says, I have a friend who claims not only does he have a Medicare Advantage plan for $0, meaning no monthly cost, but he also gets a sizable portion of his Medicare Part B premium refunded to him. How is that possible? If it's true, should I be on one of these plans? So there we go. If it's too good to be true, is it true, right? Because that's what's ingrained in us. So here's Aaron's answer. I'll read it again, hopefully without diverting too many times. So he says, there are indeed plans that have no premium and also provide a Part B premium reduction, sometimes referred to as a Part B giveback. How is it possible? Once enrolled in an Advantage plan, instead of paying any portion of the costs for covered Part A and Part B services, Medicare actually pays an approved health insurance company around $12,000 per year for each person they enroll. In turn, the insurance company agrees to take on the responsibility of providing a health insurance benefit package and paying all covered claims, minus the insured's agreed to out-of-pocket costs such as deductibles, co-pays, and co-insurance, which is a percentage of the entire billable amount. The insurance companies don't need to charge any premium. They're making a profit from the $12,000 per enrollee they get from the federal government. The low premiums, Social Security giveback in parentheses, along with the ancillary benefits or extras, which can be generous and valuable, are enticements that attract new members. The combination of them has made HMOs and PPOs extremely popular. Now, this is going to clue in more to people specifically in this area, and this is very relevant. However, in Western Pennsylvania, the plans that offer the largest Part B refunds don't come with prescription drug coverage. They're generally designed for people who can't get creditable drug coverage elsewhere, most commonly through the VA or PACE. These plans work very well for these folks and save them over $1,000 per year in Part B premiums, while offering some of the best medical and ancillary benefit packages on the Advantage plan market. We often recommend them to veterans who get all of their meds through the VA and those who have full PACE. And we'll go back and pull out some specifics on these. So here we go. Let me be clear, he says, if you don't have VA, PACE, or another prescription insurance plan, do not enroll in one of these plans without drug coverage, because you currently take generics that cost just a few dollars without insurance. It's a terrible mistake. GoodRx, Cost Plus, and $4 prescription programs are not a substitute for Part D insurance. We've met too many people who thought they didn't need drug coverage and then were prescribed oral chemo or other medications that cost thousands of dollars per month and found themselves in an absolute horrible situation, left to pay full price with no way of getting an Advantage plan or Part D that covers drugs until January of the following year. Okay, last page. Where am I at? 54. We're good. So, should Heather be on one of these plans? Not if she doesn't have PACE, VA, or another drug policy that's as good or better than Medicare's Part D benchmarks and considered creditable. There are a select few zero premium plans that offer the Social Security giveback that do have Part D drug coverage. However, the out-of-pocket expenses can be drastically different. Then he gives an illustration I'm going to skip over for now. I'd like to add Heather and others aren't always best on zero premium Advantage plans with drug coverage. In fact, we advise very few of our Advantage plans clients who don't have PACE or VA to choose one because they often have copays for hospital stays that can be $1,000 to $2,000 for a stay of 4 to 6 days or longer. Plans with small premiums generally have a per stay hospital copay that are much less expensive and usually provide better overall. So we'll stop there because there's enough bullet points in there. Yeah. I think the last one that I pulled out that he says zero premiums aren't necessarily best, even if you have other creditable drug coverage. And then he gives the example of the hospital stay. That's one of those ones that we're going to point out to you, okay? If you're doing a zero premium plan, either with or without drug coverage, depending on your situation, to me the line is somewhere between getting what you pay for, sometimes a zero premium plan, comparing to something that might be $20 to $30 or no more than $40 per month. That's money that I potentially would show someone to be well worth it, okay? And it's personal. Where I discourage people is, do I need a $200 a month Advantage plan? Is that much better than a $20 one? So the difference between 0 and 20 is probably legit. The difference between 20 and 200 probably isn't. Right. Again, that's why you need a consultation. That's why you need to come in, because your situation is yours and yours only. My brother-in-law is just turned 65, but he's in Florida. We've been looking at zero premium plans that have Part B givebacks because he uses the VA for his meds, and quite honestly, probably anything medically that he will do, he would still go to the VA. Right. So what's the conversation him and I are having? But listen, if you can get a zero premium Medicare Advantage plan that has a Part B giveback, you're not worried about getting the prescription meds because you're going to use the VA, but you can pick up some extra benefits that you're not going to get just by using the VA. There's the case in point for him. So again, do they exist? Yes. Should everyone have one? No. And should some people absolutely should not have them. And even those, Bill, who qualify for them and check all the boxes aren't necessarily better off when they have one.
It should be pointed out too, the give back is actually money that was yours to begin with.
Technically speaking,
yeah.
Yes.
I mean, because it's taken out of your Medicare payment is taken out of your Social Security payment every month. Yep. And all they're doing is refunding some or all of it back to you.
Yeah, some or all of it is a good point. Like I said, the ones here in Western PA aren't nearly as aggressive as a lot of the things that they advertise on TV, which confuses people because they'll say, "Oh, I understand that I can get." Listen, if you're hearing about it on a TV commercial, every advertisement known to man presents probably the best case scenario, right? But that doesn't mean that that's your scenario, and so
And again, you're calling a boiler room, and they're not going to fit something specifically for you. They're going to fit you.
Well, and their goal is to sell you something, right? That's their job. They have a quota. I love the fact that at the health insurance store, yes, Aaron expects us to be busy. Yes, he has the right to look at our calendars and whatever, but never once has he walked down to my office and said, "Hey, how many of this did you sell, or how many of that did you sell?" That's not the way we do it.
On the other hand, you also shouldn't be playing Angry Birds either. So.
That's true.
Well, Tony DiRoma, again, this has been an informative and just a a quick couple of hours. We'll do this again in a couple of weeks.
Yes, sir.
On Medicare A to Z with the Health Insurance Story, give them a call at 724-603-3403. WMBS Uniontown, it's 3 o'clock.
Sponsored by O'Reilly Auto Parts.
I'm Matt Piper. President Trump is about to get on the phone with Canadian Prime Minister Justin Trudeau. It's tariff talk, as 25% tariffs are set to go into effect at midnight.
Canada is very tough. They're very, very tough to do